Assalamu alaikum everyone. Hope you are doing well. Today in this video I'm going to talk about Ascaris lumbricoides. Ascaris lumbricoides. It's a common roundworm. It is the largest intestinal nematode parasiting the human. It is worldwide in distribution and most prevalent throughout the tropics, subtropics, and more prevalent in the countryside than in the city. And its common name is giant intestinal roundworm, which causes Ascariasis disease. Human is the intermediate as well as the final host. The adult worm that will be present in small intestine, whereas the larva that is in lungs. Its infective stage is the ovum. Coming to the morphology, this adult worm is cylindrical in shape, creamy white or pinkish in color, which means suppose that the freshly passed adult worm in stool that will be pink in color and it looks like an earthworm. The female worm's size that is average 20 to 40 centimeter in length and the largest is 49 centimeter. In case of male worm, it is smaller and its size is about 15 to 30 centimeter in length. It has a typical curled tail with a paired sickle-like copulatory spines. On the tip of the head, there are three lips that are arranged as a Chinese word. So male that has single reproductive tubule, whereas a female that has two reproductive tubules, and the vulva is ventrally located at the posterior part of the anterior one-third of the body. So this picture shows the male as well as the female worm. In case of male, it is small when compared to that of female, and the tail of the male that is curved ventrally in order to form a hook-like structure with a conical tip. The male genitalia consists of a single coiled tubule which comprises the testis. And whereas in case of female, it is larger when compared to that of male. And then its tail is straight and conical but not curved or pointed. The minute vulva, it opens at the junction of anterior as well as the middle third of the body on the mid-ventral part of the worm. So this part of worm, what we called it as waist. The anus that is situated at the subterminal part and it opens like a transverse slit on the ventral surface. And this picture shows the adult worm of Ascaris lumbricoides. The lips of Ascaris lumbricoides, that is, this Ascaris lumbricoides worm, it has a small mouth that is surrounded by three lips, one dorsal and two ventral. So these three lips that is seen at that anterior end, the margin of each lip that is lined with a minute teeth which is not visible at this magnification. Coming to that morphology, so egg, there are three kinds of egg: fertilized egg, unfertilized egg, decorticated eggs. We usually describe that egg in five aspects, that is its color, size, shape, shell as well as the content. So coming to that fertilized egg, so its average size is about 60 into 45 micrometer. So this fertilized egg, it will be round or oval in shape. They are bile stained and golden brown in color. The egg that will be surrounded by a thick shell with a light brown mammillated albuminous outer coat. So the content is a fertilized ovum. There is a new moon shaped clear space at each end inside the shell. So coming to that unfertilized egg, so it is long and slender when compared to that of fertilized egg. So these unfertilized eggs, it's also brown in color. It is relatively narrow as well as longer. The shell and albuminous coat are thinner than those of fertilized egg. The content is made of many refractable granules which varies in size. Next one is a decorticated egg. Both that fertilized and unfertilized eggs, sometimes they may lack their outer albuminous coat and they are colorless. So infection to man. Usually man acquires this infection when he ingests the food or water or raw material or raw vegetables or fruits or something else which is contaminated with that egg of Ascaris. So modes of transmission. Occasionally by inhalation of contaminated dust with eggs. Children playing in contaminated soil may acquire the parasite from their hands. So coming to that life cycle, site of inhabitation, that is small intestine. Infective stage, it's embryonated egg. Route of infection, that is usually by mouth. Here, the life cycle of the Ascaris lumbricoids, that is completed in a single host, that is man. Man is the only host and there is no intermediate as well as reservoir host is there that is required for the life cycle of Ascaris lumbricoids. The life cycle of that lifespan of the adult is about 1 year. So this worm, it lives in the lumen of small intestine, feeding on the intestinal content where the fertilized female lays eggs. Adult female that can produce approximately 240,000 eggs per day which are passed in fecus. When passed, the eggs are unsegmented and it requires outside development of about 3 weeks until a motile embryo is formed within the egg. So after ingestion of embryonated eggs in contaminated food or drink or from contaminated fingers. So what happens, suppose if that eggs has been ingested inside that human, so it will start hatching in the small intestine in order to liberate the larva. That is, that host digestive juices that will act on that eggshell and it will liberate that larva into that small intestine. So these larvae, it penetrate the intestinal mucosa. That is, this larva then penetrate the intestinal wall and it will start entering into the lymphatic vessels. So this larva that is carried by the portal circulation to the liver. So in that liver, it will live for about 3 to 4 days. Then they are carried to the right heart and then to the lungs. So in that lungs alveoli, the larva size will be increased. That is, its length of the larva increases and molts twice and it becomes a 4th stage larva. The larva then break out of the pulmonary capillaries and it will reach the alveoli. And then they are carried, migrate up the bronchioles, bronchi and trachea to the epiglottis. Suppose when they swallowed, the larva, it falls down into that small intestine where they develop into adult. The time from the ingestion of embryonated eggs to oviposition by the female, that is about 60 to 75 days. The adult worms, it live for about 1 year. And this is the overall life cycle of Ascaris lumbricoids. Here you can see the man, he acquires the infection by the ingestion of contaminated worms or contaminated eggs, that is in that food, water, vegetables, raw vegetables or raw foods, whatever it may be from the soil or whatever it may be, that enters to that man. That ingested eggs that will start hatching in that small intestine of the man and it liberates that larva which enters the intestinal wall and then enter lymphatic vessels. Then it is carried to the liver and then to the right heart and then to lungs. So in that lungs, the size of larva increases and molts twice and then it will reach the respiratory tract of the human. And when the human swallows it, it's swallowed back to that small intestine where it grows into an adult, matures and fertilization occurs over here and female it starts begin to lay eggs that is passed to the fecus within 60 to 75 days of infection. So in that soil you can see the temperature that is 20 to 40 degrees Celsius in soil and then humidity about 40%. Here the first stage larva which develops inside the egg within 10 to 15 days. That first stage larva that will undergo its first molt while still inside that egg, it will become second stage. Then the embryonated eggs containing that second stage, that is infective to man. This cause infection in man and that life cycle is repeated. Coming to the diagnosis. Confirmative diagnosis, it depends on the recovery as well as identification of worm or else its egg. Ascaris nemotis. Examination of sputum for Ascaris larva, that is sometimes successful. Intestinal ascariasis. The speakers were examined for that Ascaris egg. So direct fecal phlegm. It's very simple and it's very effective also. So eggs that is easily found using this way because a large number of female oviposition occurs over here, and each female approximately lays 2,40,000 eggs per day. So this method will be effective and it's the first choice. And then brine flotation method, then the recovery of the adult worms. So when the adult or adolescent, when it's found in fecals or vomit and tissues and organs of that infected person, the diagnosis may be defined. Coming to the prevention and treatment. So mebendazole, albendazole and levamisole, that's very effective. Sanitary disposal of fecus, that is the use of sanitary latrines is very must. Then hygienic habits like cleaning of hands before meals. That is, we have to improve the personal hygiene like washing hands before eating. It will be an effective way. Then health education. Afterwards, eliminate the use of human fecals as fertilizers. So untreated fecals should not be used as a fertilizers, that should be avoided. And we have to avoid eating that uncooked green vegetables, food preparations or raw fruits, something else like that, which is contaminated with the fecal eggs. Then we have to treat the infected individual. Suppose if anyone is infected, we have to treat them properly and we have to give them a good health education. Thank you.